And now, the Deeper Thinking podcast, where philosophy, psychology, and power collide.
Welcome to the Deeper Thinking podcast. Some forms of suffering don't speak in shouts. They arrive as questions, lingering in quiet rooms, asking us what kind of world we've built. There's a line between care and control, between healing and reshaping, and often it's hard to tell when we've crossed it. We think of mental wellness as a return to something, stability, function, peace. But rarely do we ask, return to what? And who defines that peace? Is it the self or the society that surrounds it? Hegel believed our distress could be understood, rational even, if we listened closely enough. Foucault more warily warned that what we call healing might sometimes be obedience in disguise. This episode sits inside that tension, between freedom and form, between support and surveillance, between the desire to belong and the fear of disappearing inside someone else's idea of wholeness. If you love what we do or have ideas for future episodes, consider leaving us a rating or review on iTunes. Listener engagement plays a crucial role in helping us stay visible and continue creating high-quality content. Thank you. And now, let's dive in. Psychological distress often appears as something intensely personal, a solitary struggle hidden deep within an individual's mind. We readily categorize experiences into neat labels like wellness or illness, rational or irrational, but beneath these tidy distinctions lies a complexity seldom explored. Perhaps psychological distress isn't merely a dysfunction needing correction, but a powerful reflection of the human condition. It might reveal how we navigate tensions between our inner desires and the external pressures imposed by society. Rather than seeing distress purely as a clinical anomaly, what if it signals a meaningful struggle between personal freedom and social conformity? Consider the pervasive anxiety felt by those trapped in unstable economic conditions, or the profound loneliness experienced by individuals marginalized due to their identity. These are not irrational responses, but rational reactions to environments that fail to nurture authentic well-being. Such distress invites us to reflect critically on society's implicit demands, on how expectations subtly shape not only behavior, but our deepest emotions and thoughts. We must ask difficult questions. Is psychological distress a sign of personal weakness or evidence of an environment that undervalues authentic expression and genuine freedom? Does the pursuit of normalcy inadvertently suppress individuality, reinforcing narrow ideals of what it means to be healthy or productive? Engaging with these questions brings us closer to understanding psychological distress as a relational phenomenon deeply embedded in social contexts. It compels clinicians, philosophers, and communities to move beyond merely diagnosing or managing symptoms and toward addressing the underlying social conditions that foster such profound struggles. Therapeutic approaches today increasingly embrace relational healing, acknowledging that mental health cannot be isolated from the quality of our relationships and social environments. Yet, even as we strive toward compassionate integration, critical caution remains necessary. Historical narratives remind us how well-intentioned psychiatric care sometimes masks subtle coercion, urging conformity rather than genuine well-being. This historical tension encourages ongoing vigilance, urging us to balance relational compassion with ethical scrutiny. Psychological distress, thus viewed, becomes more than a clinical concern. It emerges as a powerful commentary on the kind of world we build and maintain. It challenges us to examine closely the hidden costs of societal expectations, the implications of our therapeutic interventions, and the definitions of normality we implicitly endorse. By reframing distress in this broader context, we open ourselves to deeper insights about authenticity, autonomy, and social responsibility. This exploration does not diminish the real suffering psychological distress entails. Instead, it enriches our understanding, inviting us toward more compassionate, ethically responsible, and socially aware approaches to mental wellness. Philippe Pinel's reforms in psychiatric care are frequently celebrated through vivid imagery. Chains removed, shackles broken, and patients liberated by compassion and dignity. This powerful moment symbolizes a profound shift from brutality toward empathy, from oppression toward understanding. Yet behind this inspiring narrative lies a nuanced complexity that challenges simple interpretations. Pinel's humanitarian intentions were genuine, yet his reforms introduced a deeper and subtler shift: the replacement of visible physical control with invisible psychological expectations. Under the banner of moral reform, psychiatric practice began emphasizing the moral discipline of patients, reshaping their inner lives to align with societal norms. Rather than simply healing illness, caregivers were tasked with guiding behaviors, molding attitudes, and regulating emotional expression. The asylum, previously a space of overt confinement, transformed into a place of moral re-education, implicitly enforcing conformity through internalization of external values. Patients were expected not merely to recover, but to adjust their identities and behaviors to fit predetermined societal standards. This subtle form of psychological surveillance raises crucial ethical questions about the nature of compassionate care itself. Was the shift from physical restraint to moral guidance truly liberating, or did it simply replace one form of coercion with another, more subtle yet equally powerful? Pinel's approach implied that psychological distress was less about biological dysfunction and more about moral failing, an individual's inability or unwillingness to align with social expectations. Such an assumption risked implicitly stigmatizing those experiencing distress, suggesting their struggles were rooted in personal inadequacies rather than legitimate responses to difficult circumstances. Reflecting on this historical moment forces us to reconsider the ethical balance between care and control, compassion and conformity. It challenges contemporary practices to ensure they genuinely prioritize individual autonomy and authenticity, rather than quietly reinforcing narrow ideals of productivity and social acceptability. Modern mental health practice has made significant strides toward patient autonomy and individualized care. Yet subtle echoes of Pinel's legacy persist. Therapeutic environments today often carry implicit expectations about what it means to be mentally healthy, expectations defined not by patients themselves, but by societal norms and professional assumptions. We must continually question whether these practices genuinely support individual well-being or subtly pressure individuals toward conformity, unintentionally suppressing diverse expressions of identity and distress. Examining Pinel's reforms critically thus becomes not merely a historical exercise, but an urgent contemporary responsibility. It reminds us that compassionate care must remain vigilant against hidden coercion, always prioritizing genuine autonomy and recognizing psychological distress as inherently meaningful. Hegel envisioned psychological distress not as irrationality or dysfunction, but as a profoundly rational response rooted in a disrupted relationship between the self and society. In his view, mental health and psychological wellness depend fundamentally on meaningful connections and coherent integration within one's social environment. When these relational bonds weaken or fracture, whether through isolation, alienation, or societal marginalization, the resulting distress signals not individual failure, but the failure of a supportive social context. From this perspective, distress offers valuable insights into the health of our collective relationships and social structures. Hegel compels us to acknowledge that psychological suffering often arises not because individuals are inherently flawed or dysfunctional, but because their environments fail to nurture essential human needs for belonging, recognition, and purpose. Today, this relational understanding resonates deeply within contemporary therapeutic practices. Clinical approaches frequently address psychological distress by strengthening interpersonal relationships, enhancing community integration, and acknowledging social determinants such as poverty, discrimination, and marginalization. Therapies like cognitive behavioral and trauma-informed care emphasize not merely individual symptoms, but also the quality of one's relationships and social supports. Individuals experiencing persistent anxiety or depression often find relief through community-based interventions, meaningful social connections, and therapeutic relationships grounded in empathy and mutual respect. Even in the context of severe psychological experiences such as psychosis, relational approaches have demonstrated powerful potential. Trust-building, social support, and consistent relational engagement often offer pathways to healing and stability, affirming Hegel's fundamental insight that psychological distress is deeply relational, reflecting broader societal and communal dynamics. Nonetheless, Hegel's optimistic vision assumes societal structures inherently seek harmonious integration and supportive coherence. It trusts that social norms, when authentically inclusive and compassionate, can provide stable ground upon which individual freedom and identity flourish. Yet contemporary realities frequently challenge this assumption. Societies often fail to offer equitable support, and marginalized individuals experience heightened distress precisely because social norms themselves embody biases, exclusions, and inequalities. Here, Hegel's relational framework confronts critical limitations. Can authentic relational healing genuinely occur within societies structured by implicit or explicit forms of injustice and marginalization? Despite this critique, Hegel's core insight remains profoundly valuable. It urges us to address psychological distress not merely as clinical dysfunction, but as a meaningful reflection of our collective relational health. Rather than isolating individuals in their distress, it challenges clinicians, policymakers, and communities to create environments genuinely supportive of diverse identities, experiences, and needs. This relational understanding compels us toward deeper ethical and social responsibilities, affirming that psychological wellness fundamentally requires nurturing, inclusive, and authentically compassionate societies. Hegel's relational philosophy finds vivid expression in contemporary psychological practice, illuminating how psychological distress meaningfully reflects social and environmental realities. Consider the widespread experience of chronic anxiety among individuals facing persistent economic instability or precarious living conditions. This anxiety isn't simply a clinical issue. It's a rational emotional response to an unpredictable and often harsh socioeconomic landscape. Similarly, the depression and isolation frequently observed among marginalized populations, those subjected to persistent racial, gender, or class discrimination, are not irrational reactions but understandable responses to systemic exclusion and social alienation. Modern therapeutic practices increasingly recognize these relational dimensions, integrating social context into clinical interventions. Approaches such as cognitive behavioral therapy, CBT, explicitly address relational dynamics, helping individuals navigate complex social environments by developing coping strategies tailored to their lived realities. Trauma-informed care further highlights the relational nature of distress, acknowledging that trauma often arises from fractured trust, abuse, or neglect within social relationships. This approach fosters healing by rebuilding trust and strengthening supportive relational networks. Even severe psychological experiences, such as psychosis, can be better understood relationally. Contemporary interventions emphasize consistent, compassionate relationships, supportive social structures, and community integration as key elements of treatment. These relational therapies resonate with Hegel's fundamental insights, recognizing that genuine psychological healing involves not only individual clinical care, but meaningful social support and engagement. Yet this relational approach also reveals critical ethical tensions. While Hegelian perspectives assume supportive and coherent social contexts, contemporary social realities often fail to meet these ideals. Persistent inequality, social injustice, and structural marginalization severely limit opportunities for authentic relational healing. This stark reality challenges clinicians and mental health practitioners to navigate ethical complexities carefully, ensuring they don't unintentionally reinforce societal norms that marginalize or stigmatize individuals experiencing distress. Addressing this tension demands ongoing reflection about the broader sociocultural forces shaping psychological experiences. Therapeutic practices must continually balance relational support with critical awareness, remaining sensitive to hidden power dynamics that may subtly pressure individuals toward conformity rather than authentic well-being. Clinicians, counselors, and caregivers face the profound ethical responsibility of fostering relational support without inadvertently reinforcing oppressive social norms or expectations. Thus, the contemporary application of Hegel's relational philosophy extends beyond clinical practice, compelling broader social and ethical reflection. It challenges society to cultivate environments genuinely capable of supporting diverse expressions of identity, distress, and well-being. Psychological distress, when seen through this relational lens, becomes a powerful catalyst for critically evaluating the fairness, inclusivity, and compassion of the social structures we create and maintain. Michel Foucault critically challenges the optimistic narrative around psychiatric care by exposing the subtle ways in which therapeutic practices can serve broader societal agendas of conformity and control. To Foucault, the historical evolution of psychiatry, especially evident in Pinel's moral reform, was not merely a humanitarian advance, but a shift from overt physical control to covert psychological regulation. While physical shackles were removed, invisible chains remained, binding individuals through carefully managed norms, behaviors, and internalized expectations. Psychiatry, according to Foucault, did not simply heal individuals, but reshaped them, subtly enforcing conformity to societal standards disguised as therapeutic compassion. Foucault argues that psychiatric institutions historically functioned as powerful arbiters of social norms, subtly disciplining not only behaviors but beliefs, desires, and identities. Rather than neutrally addressing illness, psychiatry actively defined what constituted acceptable mental states, often pathologizing deviations that challenged prevailing social ideals. Under the guise of treatment, institutions wielded significant authority, implicitly communicating that psychological wellness depended on aligning oneself with society's dominant values and behaviors. Those who resisted or deviated risked being labeled pathological, marginalized, and subjected to interventions aimed at correcting their perceived moral or social deficiencies. For Foucault, these dynamics reveal deeper questions about power and autonomy within therapeutic relationships. Even today, the clinical encounter involves inherent power imbalances between caregivers and patients, where subtle forms of authority persist. Diagnostic categories, treatment protocols, and therapeutic expectations implicitly communicate what society values as normal or productive, exerting subtle pressures on individuals to conform. Thus, mental health practices, while genuinely seeking to alleviate suffering, may unintentionally perpetuate societal biases regarding productivity, conformity, and acceptable expressions of distress. Foucault's critical insights provoke contemporary mental health practitioners and institutions to question implicit assumptions about wellness and normalcy. He urges clinicians to remain vigilant against subtle coercion, continually examining how diagnostic labels, therapeutic goals, and treatment strategies might inadvertently reinforce oppressive social norms. His critique also calls for deeper ethical scrutiny of therapeutic relationships, pushing practitioners to prioritize genuine patient autonomy, diversity, and authentic self-expression. In highlighting these hidden dynamics, Foucault does not diminish the real suffering experienced by individuals in psychological distress. Rather, he enriches the ethical and philosophical dimensions of psychiatric practice. He prompts ongoing critical reflection on the societal implications of defining psychological wellness, emphasizing that genuine care must actively challenge rather than reinforce subtle forms of control and marginalization. Foucault's analysis remains deeply relevant today, challenging clinicians, policymakers, and society at large to continually question whose norms shape definitions of mental wellness, whose voices are privileged, and whose authentic experiences risk being pathologized or suppressed. Michel Foucault's critique gains powerful clarity when we examine precisely how psychiatric institutions historically defined and managed psychological distress. Initially viewed as cognitive or medical dysfunction, distress gradually became seen as moral deviance, a failure of individuals to conform adequately to societal expectations. This subtle yet significant shift was not accidental. It reflected broader cultural anxieties about social stability, conformity, and control. Patients in psychiatric institutions weren't merely individuals needing treatment. They became subjects to be reshaped, morally reoriented, and adjusted to societal norms. Therapeutic interventions aimed at correcting behavior, attitudes, and emotional expressions, positioning caregivers as authoritative figures tasked with guiding patients toward conformity. Foucault underscores that the moral reforms initiated by Pinel and others replaced overt physical control with nuanced psychological surveillance, embedding norms deeply within the internal world of patients. Treatment became a subtle form of discipline, quietly reshaping identities to align with socially defined standards of normalcy. Historical examples, such as the coercive treatment of King George III, vividly illustrate how institutions systematically dismantled personal autonomy, enforcing a total submission to external authority. Such practices illuminate troubling power dynamics within psychiatric care, revealing implicit expectations that individuals should internalize societal ideals to be deemed psychologically healthy. Contemporary psychiatric practices have undoubtedly progressed toward patient-centered, individualized care, emphasizing autonomy and holistic approaches. However, subtle echoes of historical coercion persist, often embedded in implicit standards about acceptable ways to behave, work, or express emotion. Diagnoses and treatments, despite genuine intentions, can inadvertently communicate expectations around productivity, conformity, and social acceptability. Individuals whose experiences or identities fall outside these implicit standards risk marginalization or stigmatization, their distress pathologized as deviance rather than legitimate expression of difference or dissent. Foucault's critical perspective thus serves as a vital reminder for modern psychiatric and mental health practice to maintain constant ethical vigilance. He compels caregivers, clinicians, and policymakers to rigorously question the hidden assumptions underlying diagnostic categories, treatment goals, and therapeutic relationships. Practitioners must carefully navigate between genuine compassion and subtle coercion, ensuring that therapeutic interventions respect and preserve patient autonomy and authentic self-expression rather than subtly enforcing conformity. This critical viewpoint encourages continual reflection about the nature of psychiatric authority, emphasizing the importance of ethically responsible, culturally sensitive, and genuinely inclusive care. Foucault's analysis challenges the mental health field not only to address individual suffering compassionately, but to remain critically aware of the broader societal norms implicitly communicated through care practices. In doing so, his critique enriches contemporary psychiatric discourse, prompting continuous re-evaluation of how therapeutic interventions can genuinely support autonomy and diversity without unintentionally reinforcing hidden forms of control. Bringing Hegel's relational philosophy into conversation with Foucault's critical stance illuminates profound tensions about psychological distress and its treatment. Hegel argues that genuine mental wellness emerges when individuals achieve meaningful integration within supportive social environments. For him, psychological distress signals a breakdown in the relational harmony between self and society, urging us to cultivate communities where authenticity and belonging thrive. Conversely, Foucault views psychiatric practices with deep skepticism, emphasizing their historical role in subtly enforcing conformity. He warns that therapeutic approaches, even when compassionate, frequently embed hidden forms of authority and social control, reshaping individuals to align with societal norms rather than nurturing authentic self-expression. This philosophical dialogue challenges our assumptions about freedom, conformity, and the ethical dimensions of psychological care. Hegel trusts that supportive and coherent societal structures inherently enable authentic freedom, suggesting relational healing as both possible and desirable. Foucault, however, questions this optimism, highlighting how societal norms often embody implicit power dynamics and cultural biases, potentially suppressing individuality in the guise of therapeutic compassion. The exchange between these perspectives poses essential ethical questions. Can we genuinely promote mental wellness within society structured around implicit conformity and normative expectations? Is it possible to foster relational integration without unintentionally marginalizing individuals whose experiences deviate from prevailing norms? In contemporary mental health practice, these philosophical tensions remain vividly relevant. Clinicians and caregivers continually navigate between promoting meaningful relational connections and safeguarding patient autonomy against subtle pressures toward conformity. Effective care demands recognizing how broader social contexts, marked by inequality, discrimination, or marginalization, profoundly influence individual experiences of psychological distress. Thus, therapeutic interventions must not only to address individual symptoms, but also critically examine societal structures that contribute to distress, fostering environments where diverse identities and experiences are genuinely respected. This ongoing philosophical conversation enriches contemporary psychiatric practice by highlighting ethical complexities often overlooked in clinical settings. Mental health professionals are encouraged to balance relational empathy with critical vigilance, remaining attuned to subtle ways therapeutic practices may unintentionally enforce conformity. Philosophically informed reflection becomes integral to ethical care, challenging caregivers to continually reassess the implicit values embedded in diagnostic labels, treatment goals, and therapeutic interactions. By maintaining this careful balance, professionals can offer genuine support while honoring patients' authenticity, autonomy, and diverse experiences. Ultimately, the dialogue between Hegel and Foucault does not prescribe definitive answers, but instead underscores the profound ethical responsibilities inherent in addressing psychological distress. It emphasizes the necessity of compassionate relational support while cautioning against subtle yet pervasive forms of social control. This dialectical tension remains unresolved, compelling continuous ethical reflection, critical inquiry, and vigilant practice within mental health care, enriching our collective understanding of wellness, authenticity, and freedom. At the heart of the dialogue between Hegel and Foucault lies a profound philosophical debate about freedom, authority, and the ethics of psychological care. Hegel's relational approach envisions individual freedom as deeply interconnected with supportive societal structures. For him, authentic freedom arises not in isolation, but within nurturing relationships that enable meaningful personal expression. Psychological distress, from this standpoint, becomes a meaningful indicator urging society to foster genuine communal connections and inclusive environments. In contrast, Foucault's critical lens exposes how societal norms and therapeutic practices can subtly but powerfully constrain individual autonomy, defining wellness in terms of compliance with implicit cultural expectations. He cautions that therapeutic interventions, even those grounded in compassion, can inadvertently impose conformity, marginalizing authentic identities or suppressing genuine dissent. These contrasting perspectives create an ethical tension central to contemporary mental health practice. Ethical care demands navigating the delicate balance between promoting meaningful relational support and safeguarding individual autonomy against subtle coercion. Therapeutic environments must remain critically aware of implicit social norms embedded within practices and ensure genuine patient autonomy rather than quietly pressuring conformity. Mental health professionals face ongoing ethical challenges. How can therapeutic practices authentically support individual freedom without unintentionally reinforcing restrictive societal norms? Is relational healing genuinely possible within societal contexts structured by implicit biases, inequalities, and exclusions? This ethical complexity underscores the need for continuous critical reflection within psychiatric practice. Clinicians, caregivers, and policymakers must rigorously question implicit values underlying diagnostic criteria, treatment goals, and therapeutic interactions, ensuring these values do not subtly restrict personal freedom or diminish diversity. Furthermore, ethical caregiving requires explicitly addressing sociocultural factors such as race, gender, class, and identity that shape psychological experiences profoundly. Effective care involves recognizing the broader societal contexts that contribute significantly to individual distress, continually advocating for more inclusive, equitable, and compassionate environments. Historically, psychiatric institutions have struggled to balance authority and compassion, often imposing subtle forms of control under the guise of care. Today, ethical practice must consciously avoid replicating these patterns, instead prioritizing transparency, patient empowerment, and authentic respect for diverse identities and experiences. Therapeutic interactions should actively affirm patient autonomy, allowing individuals to define their paths toward wellness rather than passively opting predetermined societal expectations. This philosophical dialogue does not offer easy resolutions, but highlights an essential ethical responsibility within mental health care. It urges caregivers and clinicians toward continual ethical vigilance, critical self-reflection, and compassionate relational practice. By thoughtfully navigating between supportive integration and respect for individual autonomy, contemporary mental health practice can meaningfully address psychological distress while safeguarding authentic freedom. The philosophical insights of Hegel and Foucault thus serve not merely as theoretical reflections, but as urgent ethical guides, challenging contemporary practice to continuously balance relational empathy with critical awareness, autonomy with community, and conformity with genuine individuality. In the end, the philosophical exchange between Hegel and Foucault leaves us with powerful, unresolved tensions that defy simple answers but enrich our understanding profoundly. Psychological distress, viewed through Hegel's lens, compels us to build communities capable of nurturing genuine relationships, fostering meaningful integration and accommodating diverse identities. His relational philosophy reminds us that individual well-being relies fundamentally on authentic social support, urging societies to actively cultivate compassionate and inclusive environments. Yet Hertz's critical perspective cautions against idealizing societal structures, illuminating the subtle coercion embedded within therapeutic practices and normative expectations. His analysis challenges us to maintain vigilant awareness of how societal norms can quietly enforce conformity, marginalize difference, or suppress authentic self-expression. These contrasting perspectives leave us confronting essential ethical questions about autonomy, conformity, and genuine psychological wellness. They compel mental health practitioners, caregivers, and policymakers to continually balance compassionate relational support with rigorous ethical scrutiny, ensuring therapeutic practices genuinely empower individuals rather than subtly restricting their freedom. The conversation invites us to critically examine whose voices shape definitions of wellness, whose experiences are validated or marginalized, and whose autonomy remains authentically respected within clinical and social contexts. Moreover, this dialogue emphasizes that psychological distress cannot be addressed through clinical interventions alone. Genuine mental wellness requires addressing broader societal contexts marked by inequality, discrimination, or marginalization, contexts that profoundly influence individual psychological experiences. Clinicians, communities, and policymakers face the ongoing responsibility of creating environments genuinely supportive of diverse experiences, identities, and expressions of distress, ensuring therapeutic care does not unintentionally reinforce oppressive societal norms. Thus, psychological distress emerges not merely as an individual clinical challenge, but as a profound social commentary, revealing hidden tensions between personal authenticity and societal conformity, autonomy and control, relational integration, and individual freedom. The dialogue between Hegel and Foucault enriches contemporary mental health discourse by compelling us toward deeper ethical responsibility, critical reflection, and compassionate practice. It leaves us without neat conclusions, instead challenging us to continually negotiate these ethical complexities, fostering genuine understanding, autonomy, and relational empathy in the ongoing pursuit of authentic psychological wellness. Until next time.
This episode of the Deeper Thinking podcast was written, produced, and researched by Benjamin James. It was read by Holly, a digital narrator. For further reading, resources, and a chance to support the show, visit the episode webpage, where you'll find book recommendations, key topics to explore, and a way to buy me a coffee. And if you enjoyed this episode, please consider leaving a review on your preferred platform